Hey everyone, welcome to Vet Visit. I'm Dr. Hansika Singh and I'm a veterinarian. Well, as a veterinarian, I feel that it is important for me to create awareness about some of the important zoonotic diseases as well. So today, that is on 28th of September, also known as World Rabies Day, let us address some of the frequently asked questions about this important zoonotic viral disease. So first, let us know what is rabies virus. Rabies virus is also scientifically known as Lissa virus, which belongs to the family Rhabdoviridae, is a neurotropic virus. How is rabies transmitted? Rabies is transmitted from an infected rabid animal saliva through bite or scratch. Also lick to a wound or broken skin or mucous membranes of the nose and mouth can also transmit rabies. Which animal species transmit rabies? Mammals such as dogs, cats, bats, foxes, raccoons. They are common reservoirs of rabies. Farm animals like cattle, buffalo, horses are also frequently affected. Rats, squirrels and monkeys rarely transmit rabies. How is rabies transmitted? Well, in simple terms, once rabies virus enters inside the host's body, it travels from the subcutaneous tissue or muscles to the peripheral nerve and then to the nerves of the spinal cord and brain at a speed of 12 to 24 mm per day. Once the virus reaches the brain, the infected person shows behavioral changes and clinical symptoms. What is the incubation period? That is the time period between the infection and the development of the clinical signs. Well, the incubation period in rabies may range from a few days to several months to a year or even longer. What are the factors that influence incubation period in rabies? Factors such as type of exposure, severity of bite, amount of rabies virus introduced, animal responsible for bite, immune status of the victim and site of bite. Head and neck wounds in highly innervated areas like fingers have more shorter incubation period. What are the two forms or clinical signs of rabies in dogs? Classical rabies will have two forms, which is furious and paralytic or dumb form. In furious form, the dogs will bite without any provocation, there would be aggression, and in paralytic or dumb form, there would be paralysis of various muscles, hypersalivation, foaming near the mouth would be seen. Farm animals like cattle, buffalo do not bite, but some signs such as hypersalivation, change in voice, aggression can be seen. What are the signs and symptoms of rabies in humans? Pain and itching at the site of bite wound, fever, headache lasting for 2 to 4 days, hydrophobia, which is fear of water, intolerance to bright light, noise and air is seen, hyperactivity and fear of impending death. So why does rabies cause hydrophobia, that is fear of water? Intense spasms are triggered in the throat when trying to swallow. Even the thought of swallowing can trigger these spasms, and this is where the fear comes from, due to the paralysis of the jaw muscles. So what is the treatment for rabies, and is rabies always 100% fatal? There is no specific treatment for rabies once rabies develops. And in humans caused by classical rabies virus, it is almost 100% fatal. How does one treat an animal bite? The wound should be immediately cleaned and flushed with running water and soap for at least 10 to 15 minutes. If no soap is available, then with water alone. This is the most important first aid that can be done. Also, the wound should be cleaned with 70% alcohol or povidone iodine and visit the nearest health center immediately for the post-exposure prophylaxis. Also, it is recommended not to cover the wound with dressings or bandages. In what cases vaccination is important? If a rabies suspected or confirmed animal bites or nibbles an uncovered skin, minor scratches or abrasions without bleeding, post-bite prophylaxis is absolutely important. It is done at day 0, 3, 7, 14 and 28. 0 day is the day on which the bite has occurred. Do you have to take vaccination against rabies if a vaccinated dog bites you? Well, as per the WHO guidelines, you do not need to take rabies vaccination shot if the dog is fully vaccinated against rabies and the efficacy of the vaccine has been confirmed by the laboratory evidence. Otherwise, post-exposure prophylaxis should be taken. How is the definitive diagnosis of rabies done? The definitive diagnosis can only be done on an animal after its death through the post-mortem examination of the brain tissue. And last, let's address the most important question, that is, what is the best way to prevent the spread of rabies? Well, it can only be possible through two ways. One is getting your pets vaccinated against rabies, which usually start at 3 months of their age. Not just your pets, but also try to take the community dogs and cats to the nearest veterinarian and get them also vaccinated against rabies. And last, get yourself protected against rabies, because as we got to know that there is no treatment as such for rabies. So in case of any doubt, do visit your doctor as soon as possible and completely avoid any home remedy without the consultation of your doctor. So that's it for this video. If you liked it, then please give it a thumbs up and do share this video as much as you can so that you can spread awareness about this deadly but absolutely preventable disease, rabies. If you haven't subscribed to Vet Visit, then yes, please do. While subscribing, do hit the bell icon so that you're always notified whenever a new video comes up. Do follow the Instagram and Facebook page of Vet Visit as well. I'll see you next time. Till then, take care of yourselves and keep loving animals like you always do.